We are live now, Doctor.
Okay. So good evening, everyone, and welcome to today's webinar designed especially for young ophthalmologists. We're delighted to have you with us as we explore an often overlooked but incredibly important aspect of our professional journey: how to prepare for conferences beyond the lecture halls and scientific sessions. As young ophthalmologists, conferences are not just about learning the latest surgical techniques and clinical updates. They're also opportunities to build meaningful professional relationships, to learn how to network effectively, and to start shaping your personal and professional brand. So today's session will focus on pre-conference planning, how to set your goals, choose the right sessions, and make of your time, how to make impactful presentations, networking and relationship building, practical strategies for connecting with mentors, colleagues, and industry leaders, how to make use of opportunities and make innovations, brand building, how to establish your presence in the community, both in person and online, so that your voice and contributions are recognized. So this webinar is meant to give you tools you can start applying immediately, not just for the next conference you attend, but as a lifelong strategy for professional growth. We encourage you to actively participate, ask questions, and share your experiences, because the best insights often come from shared journeys. By the end of today's session, you'll leave with a clear roadmap for how to turn every conference into an opportunity to learn, connect, and grow, not just as a clinician, but as a future leader in ophthalmology. A few words from Dr. Ravi Shankar, and then we can start.
Very good evening and namaskar, and great opportunity for me also as a chairman ARC to be part of this meeting, and hats off to the Young Ophthalmology Society of India and the team who are behind this meeting, and the list which is going to be the agenda actually is going to be a fantastic one, and I am as a delegate looking forward to hear this, and this brand of Yosai are definitely they are a part of beyond expectations, I would say, and thanks for the opportunity given to me to be part of this meeting, and hats off to the Yosai team once again, and over to the team to take over.
Thank you, our beloved ARC chairman, sir. And thank you, President TNOA Sujata ma'am, and all the office bearers of TNOA. I would like to have Dr. Divakant, sir, who is the president of UC, to have few updates for next week and before we start over. Yeah.
Yes, thank you so much, Prasanna. And again, we feel so much that like TNOA is like a parent body to YOSI, and with a new energy with Dr. Sujata Mohan ma'am and Dr. Ravi Shankar sir in the leadership, I'm sure this is bound to grow. And a very pertinent topic today about conferences. I also personally believe it's a very important aspect of networking and growing as a team together. And I'm very happy to see all our friends, the speakers from India, and especially speakers from abroad, Dr. Kaushal, Dr. Azam, Vidya, Lala, and Dr. Iftikhar. All of them are very dear friends. I'm very happy, and Dr. Udarma also, to see them here. And again, I would like to personally invite all of you to the biggest young ophthalmologist meeting ever in India. That is 5th to 7th of September. And your own team from TNOA with Niranjan and Dr. Karthikeyan, Dr. Prasanna, everybody leading from the front. So they are almost handling all aspects of what's going to happen in the meeting. And we are also looking forward to a lot of international colleagues who will be joining us for the session. So I hope to see more of you there, and best of luck for this meeting today. And thank you again to the leadership of TNOA for the constant support, and they keep giving UC opportunity at their platforms and forums. So we are very indebted to that. Thank you so much.
Thank you, Divakant sir, President UC, and so with that, we will start the curtain raiser of today's event, as Madam beautifully covered. So we are going to have 6 topics, and we have a wide variety of discussions, and we have around 6 to 7 countries to share their perspectives as well, with the one vision, one legacy, and one TNOA, the tagline that Madam has devised for this year. So welcome again, Sujata ma'am, our President TNOA. Ma'am needs no introduction, but Her profile speaks for herself with more than 10,000 LASIK procedures and 1,100 plus corneal transplants. And she has also won the Nari Shakti Puraskar Award and currently the president of TNOA. With that, again, our beloved ARC chairman, sir, we would also like to welcome sir, the co-chair of today, and Dr. Devakant and Dr. Nishant, who are all heading the VIO activities at the nation. Dr. Devakant being the president and Dr. Nishant, who actually handholded us with all the VIO activities for the last 1 or 2 years, along with Dr. VG Madana Gopalan, who's also joined with us, and Dr. Nilesh, Karthikeyan, Dr. Samir, and Dr. Madhavi will all be convening the session, along with the co-moderator, along with me, Dr. Niranjan. So we have a small change in the order, and due to logistic reasons, Dr. Aditya will be going first. Over to Dr. Niranjan to introduce the first speaker and the 2 panels along with him.
Thank you, Prasanna sir. So it is indeed my privilege to invite my co-MC member TNOA and executive member Yosi Aditya sir. So sir has completed his MBBS and MS and his fellow in World Congress of Refractive Surgery. He has performed over 3,000 cataract surgeries. He is a pro in Smile Pro and every possible refractive surgery. And it is indeed nobody better who can talk to us about this topic today. We welcome you, sir. And we have a couple of panelists. One, Dr. Mohammad Iftikhar Iqbal, and he is a leading young glaucoma specialist from Bangladesh and currently working there as a consultant at Isfahani Islamia Eye Institute and Hospital. It is he has several accolades, and the list is quite exhaustive in itself. So we welcome you, sir. And next we have Dr. Muhammad Abrar, who's currently pursuing his fellowship in Vitreoretina at Agarwal Zai Hospital and has cleared several international exams and won several quizzes at state and national level. So over to you, Aditya sir, for your talk.
Okay, thanks a lot, Niranjan, for that very kind introduction. So let me just share my screen here. Okay, so I hope I'm visible and audible, right?
Yes,
You
yes.
are.
Yeah. Okay, right. So thanks a lot again, and thanks to the Yo leadership of TNOA for giving me this opportunity. So I think this is a very interesting topic that I was given. It says transcending borders beyond the lecture hall, workshops, wet labs, and live surgery. So only when I actually saw this topic did I realize, yes, actually a lot of my career has been shaped by going through all of these experiences. So sometimes only when you actually sit down and you prepare about a topic, you realize retrospectively, and all of these things have actually helped shape your career. So it's very nice for me to share my experiences now with pertaining to these 3 topics: workshops, wet labs, and live surgery. So let me just start by telling you this. So growth as a young ophthalmologist, of course, we attend many lectures. We've seen countless lectures throughout our course of PG, fellowship, and now as early career ophthalmologists. So lectures will shape your mind. Workshops will shape your skills. Wet labs will give you your confidence in your motor skills. And live surgery will shape your spirit. So as growth as a young ophthalmologist begins when you just step beyond just listening and step into more immersive experiences. And sometimes these experiences can also be nerve-wracking, but they genuinely transform you and your personality. So we'll start by workshops. So why should you take the time and effort to attend a very intensive workshop to advance your skills in a particular subspecialty? So unlike lectures, workshops are most structured learning sessions. They will bridge the gap between just lectures and clinical practice. There might be many types. Some are just didactic, they're just extended lectures with case discussions and whatnot. And some will be more interactive and they'll be more skills based with their demonstrations and live simulations also. So it depends what type of workshop you're going to, where the ultimate goal is to deepen the understanding of that topic and build your decision making. So like I said, there are many types of workshops. One might be just case-based workshops where you learn about, for example, if you're doing a refractive surgery workshop, you learn about planning, you learn about biometry, how to read a topography report, etc. Some will also have simulation, they'll have dry labs, For example, you might be given a simulation on a model eye when doing phaco, or you might be able to actually get a hands-on with some lasers. Some will be just purely technology driven, where you might learn about new machines, how to use them best in your practice, how it can help with your decision making. These might be more industry focused, and some will be more about the clinical judgment, interesting cases, and whatnot. So the types of workshops are very vast. It can vary from one workshop to the next, but it depends upon what you actually want to advance in which subspecialty and what exactly you want to take out of it. They do add some value, so it's more of a deep dive where the faculty will be more interactive. It's not that like where you just sit down and lecture and you listen to one talk for about 10 minutes each and for about 3 hours long course. It's more of a safe space where you can ask very basic questions as an ophthalmologist. For example, when I went to a workshop in Narayana Nitral, I learned about topography. I went there as a postgraduate, and I was filled in with a room of much more senior practitioners. But because this was a closed space, I had no hesitations at all to ask them about very, very basic questions about topography. And I still carry that knowledge with me today, and I still use it every day today to judge for my refractive surgery patients. So it's more about exposure, and you get feedback from the seniors and on how to advance your skills. So one thing is, not all workshops are the same. You have to really research and see which kind of workshop is actually worth your time in attending. It's a limited thing. So you do take your time to research and ask your peers about which one to attend, so you actually get something out of it. How to maximize learning from a workshop? You have to prepare beforehand. Rather than going in fresh, it's better to revise some basics about a topic before you go ahead. Engage very actively. Do not be shy. It's okay. There are no such thing as stupid questions at all. You have to swallow all of your ego and pride and go there with a single mindset of trying to learn something from there. And take some notes, whatever interesting things that you learn. It's better to make some notes so you go ahead and apply it. Networking is very important. You build a lot of contacts, and you can identify at least one or two key changes that you will learn that you'll be bringing into your practice. Whatever you learn in the workshops or your lectures will be very vast. You can't apply everything. As long as you apply one or two key things, that's more than enough. So my experience is, I attended the workshop in Narayana Netralia about topography, and I still use it every day. I learned my DSEC for cornea when I went to one workshop in LVPI. It was a 2-day workshop, but they actually gave us a live patient to perform DSEC in. That's something I'll never forget. One of my favorite ones was when I attended the refractive surgery workshop in London Vision Clinic, and following that in 23, I started to perform Press Beyond. And sometimes it just does not stop there. So when you go to these workshops, you build phenomenal contacts by speaking to like-minded individuals. This was the contact I made with Professor Dan Reinstead when I attended the course on Press Beyond, and I made personal touch with him. And then when we launched Press Beyond at our center, Umai Clinic, he actually was there in India at the same time, and he gave us that's such a nice launch opportunity where he came and visited our center. We had a press meet, and we officially launched a Press Beyond at Umay Clinic with the founder, which was Professor Dan Reinstein. So these are very, very unique contacts and networking opportunities you will get when you attend such events. So attending one workshop led to the launching of Press Beyond at a clinic with great success. And once I did that, and I started doing Press Beyond with good results, I was invited as a global speaker in the Zeiss user meets in Korea, Budapest, and all of that. I'm also now involved in one of the global clinical trials. So one thing leads to the other. The true value of a workshop is in the application, interactivity, and the context-specific pearls that accelerate your practice just from theory to practical application. Wet labs and the next thing. So wet labs, again, you will have very many opportunities in many conferences. The most common ones we look at are things like phaco, corneal suturing, iris techniques, and all of that. This is a transitional step that you right from theory to practice. You as a young surgeon, you need to develop hand-eye coordination, instrument handling, and surgical judgment. And this is a very low risk setting for you to go and practice all of this. Very, very useful, because you learn a lot of motor skills. There is a lot of margin for error. One of the workshops, the wet labs I attended was in AACRS. That's where I actually learned how to implant CTR. And again, the one thing that I learned there on how to implant it and dial it and safely into the capsular bag is something I still use every day. So please do attend a lot of these wet labs if possible. even if it is something very simple like corneal suturing or how to use iris hooks and all of that, it's very, very useful. A lot of these tips that you pick up from these wet labs, you'll use in your day-to-day practice. How do you maximize it? You have to ask the faculty for critique. Don't just go to the wet lab with the mind that I can do things perfectly. You have to ask them for critique constantly. And some of the faculty in the wet labs will actually keep in touch with you in the future. They might even exchange your emails or phone number, and you can ask them doubts even after the wet lab is over. So you keep to continue to progress. Life surgery is another very interesting topic. So again, a lot of us are very enamored by life surgery, where it's a real-time performance of a surgical procedure in front of a live audience. The ultimate aim is for it to be educational, to show real-time decision making and how to manage unusual situations. There's a lot of transparency that's involved in the live surgery. Advantages is that it's an unedited exposure. So many times, all of us are very guilty of this. Whenever we go and show our surgical videos, it's all perfectly edited, where the patient was cooperative and everything went according to plan. We've done a very fast surgery. That's what we usually want to show. But live surgery is very raw. So you see the real unedited footage where sometimes something is little unusual, or when the surgeon does something very differently and very efficiently, you actually learn a lot. So I've learned a lot through live surgery because I see how different surgeons are doing their day-to-day surgeries in a very efficient way. There's something you can very actively pick up when you see a master surgeon performing live surgery. So for me, my inspiration was my father, who used to perform multiple live surgeries, and he used to do it so flawlessly and so efficiently. What I really admired was the calm and the composure with which my father would perform. Also, I was very inspired by many stalwarts who used to perform live surgery very casually and very nicely, like Dr. Mohan Rajan sir, Dr. Sri Ganesh sir, who really inspired me to try to do this in some time in the future. For me, the opportunity came very early. Just about 6 months after I graduated from PG, I was 27. I just turned 28. 1 month after turning 28, Dr. Mohan Rajan sir invited me for live surgery at Rajan Eye Care Surgical Strike. So this is something I'll never forget in my life. So sir has always been very encouraging to young ophthalmologists. So the moment he asked me, for some reason I said yes. I still don't know why I said yes at that point of time, because to perform live surgery at the age of 28 in the midst of so many senior surgeons at that point of time, I'll be very honest, I had imposter syndrome. I thought to myself, what am I doing here? But sometimes you take these risks and they pay off. So the one time I performed live surgery there at Rajan Eye Care for the first time, and then it's a cascading effect. I got more confident to perform more live surgeries in the future. The same year, I had to perform another live surgery, which was from my center, which was relayed to 100 ophthalmologists in Russia. And that was a conference that was sponsored by Appasamy, and I had to use their phaco machine. And that was the first time I was using the phaco machine. So these are experiences that you have to kind of take a small risk and do as a young ophthalmologist, because it really molds you. And I also now UOC has also taken a step forward in this regard, where I think around 8 or 9 young ophthalmologists performed live surgery at Rajan Eye Care, and all of us had a very, very nice time and a great experience. So it's not just about proving that you're perfect; it's about trying to get the feel of operating under pressure. So you will be forced to perform under pressure in many times in your practice. So whether you're doing live surgery, or you're operating on a VIP or a relative or a family or a friend, you will feel a little pressure there. So you need to be able to handle that pressure mentally and perform at your best. So some live surgery really does help you in that regard. And if you have the opportunity to do it, or at least witness live surgery, I would really, really recommend that you do so. So to conclude, workshops, wet lab, and live surgery are like compounding for surgeons. Every small step, every repetition, every risk will add up, and overall, these experiences will turn your personality. You will get better, and will give you the confidence far beyond than just what lectures can give you. Thank you for your attention.
Thank you so much, Aditya sir. So we have a stellar group of panelists, and I request. Am I audible, ma'am?
Yeah, you are.
Yeah, you are.
Just a second. Yeah. So thank you, sir. Thank you for covering comprehensively about the whole session. So to speak on, to share their perspectives on this topic, I invite the panelists from, one second, just So, Dr. Mohammed Iftikhar Iqbal, sir, are you there with us? Yeah.
Yeah, thank you very much for your kind introduction earlier, and it's truly an honor to join this distinguished panel. I think the presenter already described in the details about what is like the international workshops, wet labs, and the live surgical demonstration. I think when we talk about the transcending borders beyond the lecture hall, that's what we really think about or talk about. That is the future of the ophthalmic education. As we all know, we are most of the surgeons, and we all know that no amount of reading or lectures can deal with those things that we are experiencing in the conferences or the live surgeries or in the wet lab. So in case of international wet labs and the workshops, that is the bridging between the hands-on as well as the knowledge we have gathered from the from the textbook. And another thing is about the live surgical demonstration. That is the one thing actually. Surgeon, we have to be a surgeon, but we don't want to be a perfectionist, because it's all about adaptability. Because we can't be perfect in 100%. So that's why we have to be a much adaptable in the situation where complications can happen even in the hands of the best. So watching a senior surgeon calmly navigate those moments teaches us, the young ophthalmologist, lessons that no textbook will teach us. So I think, and another thing is after the conferences, it's not just about the gaining some knowledge or sharing some thoughts. It's about the collaboration, multi-center trials, and lifelong mentorship. I think that's what we're going to right now. And thank you.
Just one word I would like to add. Aditya comes from a great legacy. His father is one of the leading ophthalmologists in Chennai, and still he has taken the time to go to different places to learn, and that only makes him makes a difference. That makes it, because he doesn't have the ego that he should not go to any place, because his father himself is a very great refractive surgeon. And still he has gone to Narayan Nethralaya to learn topography. He has gone to so many places. Hats off to you, Aditya, and that's the reason why you're here. So very well known. Congratulations.
Thank you. Thanks a lot, man. Thank you.
Thank you, madam. Thank you so much. Dr. Abrar?
Yeah.
Thoughts?
Very good speech, very good lecture, the presentation by Dr. Aditya, sir. I've been lucky also to be participate in his own workshops on refractive surgery too. The thing is about live surgeries, you get to see the master surgeons operate from the side. Like in all YouTube, in this era of YouTube channels, you see a lot of surgeries on YouTube by a touch of a click in a phone or in a tab. But when you see the surgeon operate from the side view, or in live surgery, you get a different perspective, and you can see how they modify certain small tips and tricks. So those are very valuable lessons one can learn.
Thank you. Thank you so much, Abrar, for your insights and your perspectives. Over to you, Prasanna, sir.
Yeah. Thank you. Thank you, Dr. Aditya. Next, I would like to call upon another TNOA Young Leader Forum member, Dr. Niranjan Karthik. Madhavi ma'am, over to you for the kind introduction, another convener of the day, to introduce Dr.
Yeah.
Niranjan and the panel.
Thank you, Dr. Prasanna. So I'm happy to invite our next speaker, ever dynamic YO, Dr. Niranjan Karthik, who had completed his fellowship comprehensive ophthalmology, and currently he serves as a junior consultant in Niranjan Nirmal Sai Hospital. So he will be talking to us on presenting your work with impact, posters and papers. On the panel, we have our international YO, Dr. Vidya Nilamani, who is a consultant ophthalmologist and lecturer in Kuala Lumpur, Malaysia. She comes with a great number of conference achievements, posters, etc. She has achieved the Outstanding Service Award in 2024. She was Best Student Part 3 exam in the University of Malaya. Welcome, Dr. Vidya. Our next panelist is Dr. Siva Vignesh. He has done his MS from prestigious RIO GOH, and he has presented multiple papers at national and state conferences, posters and articles in multiple national index journals. Currently, he serves as the senior consultant phaco refractive and cornea surgeon at Maxivision Eye Hospital, Tanjore. Welcome, Dr. Siva Vignesh.
Thank you, ma'am. Thank you so much for the
Over
kind.
to you, Dr. Niranjan.
Thank you. Thank you so much, ma'am. Is my screen visible?
Yeah.
Yeah.
Right. So thank you all for the wonderful opportunity. Thank you, TNOA and Yossi, for having me on this platform. So today I've been given a very interesting topic, but having to cover it in a 4-minute time period is a little tough, but I hope I'll do justice to it as well. So we're going to talk about 2 sections today. One is about how to master making your posters, and second is about approaching mentors and learning from them. So as Aditya sir has mentioned, both of these are really a game changer when it comes to conferences. So why do conferences matter to young ophthalmologists? So of these 4 aspects, I've highlighted 3 of them, highlighting my area of topic today. That is networking opportunities with mentors and a stage for presenting your work and efforts. So what are the common pitfalls that young ophthalmologists or YOs do? Is they tend to be a very passive audience, just listening to various lectures. And often they are not having enough guidance as to what is to be presented in the posters and how it is to be presented. Third is missing out on opportunities to interact with seniors. And this is very rare an opportunity because it is not often that you find stalwarts at an arm's distance to talk to them. And last but not the least, there is often an information overload at the end of the day when one attends a conference without a proper strategy. So first section is about getting the posters right. And I'm going to highlight on certain key principles like simplicity, clarity, visual balance, and legibility. So it is very important for us to understand that our poster in a scientific conference is like our business card or our visiting card. So it is going to have to deliver a lot about us in the most concise way possible. So this is the outline or the skeleton of a good poster. And this is very important to understand that as I've tried to compile it in the shortest way possible, a poster needs to be quite concise. The title being clear and short, introduction just highlighting why the whole poster matters, methods highlighting with the help of some flowcharts and minimal amount of text as possible, and using graphs and images to enhance your results, and finally a crisp take-home message which many people fail to deliver. So what are the do's and don'ts while you design this poster is first is try to stick to the bulletin point format, use adequately sized fonts, ensure you have enough negative space or the white space, use high resolution images, and try to have some way of coding using colors because that goes a long way in making your poster stand a class apart, and avoid cluttering and blocks of texts. What should you not do? Avoid long paragraphs like I just mentioned, and don't overdo the coloring part and avoid jargon to the maximum extent possible because it is not just the subject experts who come to judge you, but there may be certain beginners in the particular field, like there may be PGs or even undergraduates who may be interested attending the conferences, and they should also be able to understand this poster which is supposed to speak for itself. Now, it's always good to have a 2-minute poster pitch. This is to attract and gain the attention of the judges, and overall try to engage the visitors, try to ask questions, ask them as to what they would like to know more about your poster. And while doing that, handling questions can be little challenging. It's important to be open and not very defensive about your work. Enhance or express your limitations in having conducted that study or the case report. Acknowledge about what you don't know about it, and or in a better way what you're still learning about it. And do note the suggestions that are given to you because that would be really useful while you take it forward to the next part of the pathway, which is publication. So this, I had the privilege of writing a communication in our esteemed journal of TJOSR, where often PGs fail to do the last mile. That is, they don't take it forward to a publication, and the feedback from the posters can prove as a pivotal tool in doing that. So culminating into a publication is what every poster should lead to. Now, moving on to the mentors part. So often interacting with mentors can have 3 prongs to it. One is transfer of knowledge, collaborating for research, and the most important is career guidance. So what are the ways you can avail their time and attention? First and foremost, express your interest not just verbally, but by actually, involving your time in it. Attend their sessions, engage in their workshops, and that is when they will know that you are actually interested and not just doing it for the sake of doing it. And then, if possible, seek introduction to them via peers. So when you are attending conferences, there will be somebody in between who knows both you and your mentor that you want to interact with. So try to approach them and get an introduction. And how to approach a mentor. Once you get introduced, be very respectful and humble. Introduce yourself briefly and also don't fail to express your shared interests. And these effective conversations should include open-ended questions, sharing of aspirations, and don't forget to ask feedback on what work you've already done. Building long-term relationships is the last part of the journey where you try to stay in touch with them like Aditya sir has done by staying in touch with Ranstein sir. So this is how the networking grows further. So overall, young ophthalmologist should first present his or her poster, take feedback from others and the mentor, work on it, improve his or her study report, whatever, and finally end up with a publication in a wonderful journal. So thank you again for the opportunity to present on this topic. And for any queries, I'll be happy to answer, and over to the panelists.
It was a very nice talk, Niranjan. Within the 4-minute time, you have to concise everything, all two topics together, and it's very precisely told. To be frank, this poster to publication, this is where every ophthalmologist youngsters are lacking, including myself. I was struggling. So after my mentor, Sharmila ma'am, pushed me to do it, I did. So same thing, everyone have to first pass that hurdle. And during the conferences, as you said, we should not be just standing at the corridor and saying hi, making a friendship, old friends, meeting them, and then going off and missing the major chunk of the where we can learn from the people. So without hesitation, we should go forward and ask them when they are speaking. Like after the session is over, they can have a one-to-one session with them like 2 minutes. Nowadays, there are a lot of sessions happening, even in the conferences, to have one-to-one sessions with them so that we can have a good mentorship later on. And regarding the second part, when you are doing like networking, I heard Prasanna sir was saying regarding this networking. A lot of leadership development programs are happening. AO is also is conducting throughout it. And then APO, AO, everything is having leadership development program. All these help, maybe Prasanna sir would be more, can give insight over it because he's done more and more nowadays. So these things can help us to go for a global networking and then learn more and more, and we can collaborate for further researches articles on what we are doing so that we can have a global collaboration also. And with regarding mentorship programs, few of the mentorship programs are available in American AO, like Vision Mentorship Program. There is a Vision Mentorship Program available, so that where they can go for us. So and I heard a Women in Ophthalmology Mentorship Program. So I just want to mention it, where they can have only women in that closed group, so they can learn from the mentor to mentee they have. So these are things I just want to convey, but you have concise in a very cut-short form, very, very nice. Thank you, Niranjan.
Thank you, sir. Dr. Vidya?
Hi, good evening. I'm Dr. Vidya from Malaysia. Okay, excellent presentation, Dr. Niranjan. You have actually laid out what are the important crucial points for the poster presentation, because for every young ophthalmologist, the starting point will always be a poster presentation. That's when they can go next level by an oral presentation and step forward. So for the poster presentation, having a good title with a relevant and not overloading with a lot of wording is the most important thing. And I would like to add on that sometimes, they could be interested in your poster, but they might not have the time to read. So you can have like a QR code at the bottom so that it will be like a personal connection a networking. Maybe you can provide your email address or contact number. So that will actually be a part of networking. And for the oral presentation, you must remember that, for each presentation that you're going to do, it's not that you're going to impress with how much that you know, but how much that people can remember at the end of the presentation. So that will be an impactful thing that they could actually relate to their work and also in their career. And for the mentorship part, yeah, I agree that for every young ophthalmologist, I mean, if any doctors, for the youngsters especially, we had the hesitation to approach to the seniors, but conferences, and I think Young Ophthalmologist platform is an excellent platform for connection. I 100% agree to that, because we can connect to many people throughout the Asian countries and around the world. And also create an opportunity for our career development. And mentorship should always begin with, we should go forward and approach them, because until we didn't approach, then things will not work. Yeah, so I think it's an excellent, even this platform is an excellent thing, and I'm really grateful for this opportunity.
Thank you so much, Dr. Vidya. Thank you so much for your insights.
You're welcome.
Over to you, Prasanna, sir.
Samir.
Very good evening, everyone. So our next speaker would be Dr. Prasanna Venkatesh Ramesh, and he'll be talking about cultivating lasting professional alliances and transforming connections into collaboration. So Dr. Prasanna, his achievements are never ending. So rather than that, probably the most valuable, I usually tag along with him whenever I go to conferences and all. And he has, told a lot, emphasized always about, building connections and all those things. And probably the most valuable connection that I have ever made was him. That connection which eventually transformed into mentorship and then friendship and then brotherhood. So I don't think there could be a better speaker than him on this. And then we have our international panelist, Dr. Azam. He's the head of ophthalmology and a veterinary surgeon in IGMH Government Hospital, Maldives. He's a YO leader from Maldives and also the founder member and president of the Maldives Ophthalmology Society. A very warm welcome to you, Dr. Azam. Then we have Dr. Deepak Arthur, who's a consultant vitreoretinal surgeon and associate professor at Joseph Eye Hospital, Trichy. He completed his education from CMC Vellore, followed by a fellowship at Arvind Eye Hospital, and has several awards and publications to his name. A very warm welcome to Dr. Deepak Arthur, and over to you, Dr. Prasanna, sir.
Thank you, Sam. That was a very candid and a very emotional introduction. And thank you to TNOA for this wonderful opportunity. Hope my slides are visible.
Yeah, it's visible.
Yes, ma'am. Yeah, thank you. So global networking and cultivating lasting professional alliances. So first things first, thank you, Sujata ma'am, Mohan Rajan sir. I started, I got into ophthalmology because of Mohan Rajan sir. And of course, to our secretary as well as our ARC chairman, sir, for this wonderful opportunity. So my objectives of this talk is going to be these 5 points: engage, collaborate, inspire, represent, and network. And why global networking? Again, to just add on a bit few to the regional and the national networking. It is definitely going to be a collaborative as well as a clinical research practices where it's going to be make a lot of difference for your innovative exposures. Engage. So in 2019, when I was just finishing my fellowship and I went to Australia, Melbourne for a World Glaucoma Congress. So this is my picture in 2019 and I landed in a wet lab to learn MIGS. And you can see this is my own picture of an iris and a glaucose eye stent, and that those were the times when it was too far ahead. Actually, Dr. Aditya beautifully told, go to wet labs, learn as maximum as you can. And iris is still not come to India, my dear friends. It's only the eye stent and the other mix that are available. So I learned it in a wet lab. And if you cut 6 years later, and these are all my students all over the country, as well as I have a fellow as well as from Malaysia as well, Dr. Pushpa Raman. So crossing borders in mixed training. So she's the Malaysian Glaucoma Society secretary. And I was lucky to engage with so many people to learn. I learned and now I'm teaching at my center, MIGS. And again, why to collaborate? So for a neophyte or a beginner watching this, this was my first conference after COVID when I wanted to go to APAO. I started exploring grants. So you have a grant system of close to 25,000 INR, which you can actually apply. AOS gives you these fellowships where you can actually go to certain podiums and where you can actually get recognized, get connected with people like Clement Tham, and the connections that you form here will actually take a long way forward, where you can conduct courses, where you can win photography awards. So these are some of my photography awards. And why you do it? Because you not only win an award, but you get a free entry pass into the cultural competition. If you watch this one, the award presentation will take place at the cultural party, which is close to 30 to 40 US dollars. So these are some of the things as a young ophthalmologist which motivates you. It opens doors, builds your visibility, and creates connections. So most of my international congresses, I started in this template that can we really aim for a grant? And that really helped my networking journey, because again, WGC Rome in 2023, I was able to win 1,000 euros. And this happens if your paper scores more. When they evaluate your paper, if your paper is scoring more, that is the papers which they'll be giving you the grant. So that is very, very important. And not only that, see this arrow here, your registration fees gets waived off. So that really makes a lot of difference if you're an aspiring young ophthalmologist, less than 40 or 45 years of age. You will be able to penetrate into the who's who conferences of the globe, and you get to network again, meeting Clement Tham sir for the second time and getting connected with Aik Ahmed sir and whatnot. And there is another grant which I recently found out, not only travel grants and the complimentary registration. So this is an accommodation grant which ASCRS gives you, where, once you win it, there is an in-depth interview that you need to go and undertake. For example, you go to the Congress this year, you will have to undertake that interview. And once you win it, and the next year you get this particular accommodation in a 5-star hotel for 5 nights. And this is my checkout bill of zero, where you can see you and an accompanying person, myself and my spouse and colleague, Dr. Anugraha, we are surgeon. So you can check out with zero, and these things makes a lot of role in your early practice where you want to travel, and you keep this as an habit. And this is my WGC in Hawaii this year in 2023, where you can again go for the grant. See, again, it's not that difficult. You just need a good paper and a good poster or that beautifully Niranjan covered. And fostering collaboration once you move towards congresses. I was lucky to part of Yo Global Congress, where I was able to introduce with Professor Ong Tin with the help of my good friend Dr. Pushpa again and Dr. Sudha from Malaysia. And when you go to a congress, try to meet new people, try to share your work, try to develop meaningful relationships as to what is the work that you are doing when you get to meet them. And then you may never know, you may be able to, take a leadership position in your parent society or your OYO society, where you will be helping in an MOU kind of an association between, where I was able to foster an MOU between our YOSI as well as our Nepal parent society. And you get to get connected with more people, and your work will also reach through abstracts. And then that is how you start to be getting an invited faculty, where next year I am invited for APGC and WGC as well. And more fostering collaborations will make you make your presence felt. What is your strength? If you are interested in editorial, so this was one of my recent editorial write-ups for young ophthalmologists unite at APAO AOS 2025, where the supranational society recognizes you for what you are, and you will be able to transcend borders. Coming to the Inspire part, so this is ASCRS 2025. For the last 4 years, this was one competition that I was always aiming on. I labeled it as from Trichy to Los Angeles. So they have this accelerator competition where innovators can go and present their product. It is not only an innovative product, you need to have a startup and you need to have a full-fledged business model, because there are 3 layers, and the final layer is you need to go and present at LA. So this year I was lucky to win 5,000 US dollars for my work, which I presented at LA. And they have this huge Shark Tank competition where 8 judges grill you for 8 minutes. Each one grills you, and then finally they announce the winner. So all over the globe, people participate in this competition because the prize money is quite huge and the competition has very multiple layers. And then I tried for 4 years, and this year I was able to not only crack it, but I was also able to win it. And these are some of the opportunities that every young ophthalmologist should actually, utilize it, because these are something that really makes you and puts you on the global map. And miss no opportunity, especially this is one of my presentations in AACRS 2023, a global presentation, keeping it in a demo concept, trying to make sure putting your work on the plate and showing what is that you have done, making sure you present it on a global market really makes a lot of difference, because you not only leave something behind, but you also inspire. And that journey led me to a very special one. This year I had my first book that I was able to do a standalone along with my co-editor, Dr. Shruti Vaishali Ramesh. And I was able to launch it at the APAV this year. And not only that, what made it very special for me is my 28 APAO LDP friends. They took these copies along with them and they helped me place it in 28 countries. It's a global book that I have written because White Press distributes it in all the countries. But this network that you build, these are my colleagues and my classmates in APAO LDP, as Dr. Shiva Vignesh was telling very beautifully. So they helped me get this book not only in India, but in 28 countries. Your work reaches very quickly and you people get to read about your work, and that these are some of the fostering collaborations that you make. Say yes to opportunity is the first step of networking strategy. I always believe that when you are young, say as much as yes rather than a no, or can't say an yes. Yes is the way forward, because if you participate, once you participate and when you present your work and you win and you engage with so many people, I was able to win in the APAO congresses. That is which takes you to these kind of programs like the LDP program, which I was able to be one of the Indians to represent India at Bali, Nepal, and New Delhi, where we had the graduation, where we got this graduation medal from Dr. Clement Tham, who I was constantly meeting. And finally, you get to graduate from his hands, and you get to graduate with so many of your like-minded colleagues, and you get to rub shoulders with them, and you get to meet with them, and your whole perspective changes about how the way you look about ophthalmology as a whole. And I always feel you always give back to the community when you go into the community. And this is one of our pictures at the Taiwan Congress where we all united. And not only that, you have so many opportunities like the media mice who selects 50 group of friends. In ASCRS, I was selected as one of his 38. And in Manila, I was selected as one of his 20. So these are so many other avenues that you need to keep in track when you travel globally. Keep a track of all the things, I always believe, be the first person to go to the conference and try to utilize what are all the maximum networking strategies. And sometimes be there and see what is happening and take 1 or 2 days extra to see the city rather than trying to go away from the conference hall. And try to make sure of all opportunities like an instructor, chief instruction courses, which I was able to be a part of, and winning awards, which comes along the way for the hard work that you make, because it's your shared idea, purpose, and the global friendships that you make and interact, which keeps putting you on the podium along up to the APACRS podium, where we got the opportunity to meet, interact, and network. So networking has taken us here where we had, I have been part of many of these webinars, and some of my friends have been here today from 6 or 7 different countries. And these are some of our pictures, and we have contributed, and many of them have contributed to our times as well. That is what is cross networking and cross collaboration. And this year we had the Global Vayo, where I was one of the Indians to be interacted, and we get to interact with these peoples in presidential dinner, making use of presidential dinner networking, because it is a very, very important one to attend the presidential dinner if you get the RSVP. And it's a very prestigious one as well. They have a limited number of RSVPs. And this is one of my very fond clips in my APAO LDP, where our mentor, as well as chair, Professor Moeen, you can see Professor Moeen here. He's one of the APAO LDP. He's a chairperson, where, when networking found its beat, they have a different school of networking itself. So we had a 1 hour of icebreaker sessions. So when you're given a platform, the summary is use it to represent it more than yourself. Represent yourself, yes. Represent your country, represent your institution and your global vision for what you are actually, going and representing. And this was the reason last month when I represented for the Dr. Chin Chin Pan Travel Grant Award of 500 USD at the third Global YO. Among 7 countries from Hong Kong, USA, we had Grayson also. Grayson is one of the committee members in American Academy. And I was proud to represent my roots coming from Tamil Nadu. Again, we are here at TNOA with my attire. And here we are with a lot of networking avenues, a lot of global opportunities. And these are summary of my grants as well as, that really motivates you because you spend very less when you travel. And some of the named awards that I was able to crack in the international forum. And on a lighter note, building barriers, breaking bonds at Taiwan. This was one of my socio-cultural performances with my colleagues here. I have innovated a new suit and most of my colleagues from other countries really loved it. And this is one of our performances with Dr. Pooja Kamar and myself. We sang the Kolaveri also in the presidential dinner on a lighter note. So thank you once again, TNOA, for this opportunity to share exclusively on my journey, on how I am going about. It's a very small journey of 7 or 8 years in ophthalmology. And thank you, Sujata ma'am, for giving me the opportunity.
I don't know if you people are inspired. I'm very much inspired, Prasanna. You really outshone yourself. I mean, you are an example everybody should follow. And you do it so in a very humble fashion. So I leave it to the moderators to discuss further.
Thank you. Thank you, ma'am. Coming from you means a lot to me, ma'am. Thank you, ma'am.
Hi, Prasanna. Am I audible?
Yes, Dr. Deepak, yes.
Yes, Dr. Prasanna, that was an amazing talk that you gave about all your experiences and the grants that you had received and all your wonderful performances. Though we get to see them every day on your WhatsApp statuses, seeing them on a professional forum was really inspiring. So I think, yes, as Dr. Prasanna said, and as we had discussed in one of our previous webinars as well, getting to reach out to these grants for these international conferences is a great way to network. And on a slightly deviating to a slightly different note, since we are all ophthalmologists, we were talking about ophthalm-related conferences. Since I'm a part of Rotary, which is another bigger network, we have so many other non-ophthalmic organizations which help ophthalmic professionals or medical professionals to network with other medical professionals around the world. Because restoring vision and eye corneal transplantation has been a global network, and such organizations have different avenues through which we can form networks through non-ophthalmic or non-medical people as well, and they help create a bigger network on a parallel way how we do it amongst our ophthalmologists. So in such a forum, we just do not benefit ourselves, but also on another way we get to contribute to the world as well. So that is another parallel thing that we need to think about. And it also not only gives them the chance to interact with us, but us to go and serve in other nations as well, not just attend conferences, but also as service camps or as projects where we can go abroad, build networks, and provide what we can, our services to the other countries and needy nations as well. So that is another perspective of global networking in ophthalmology that I was thinking of, Prasanna.
Thank you, Deepak. Azam sir, you're on mute, sir. I mean, one of the persons who I've learned network.
I'm here. I'm always very impressed with your presentations, your achievements in such a small, short amount of time. And I think everyone should really learn from what you have done. You are basically giving all your tips and tricks for free, and everyone, you not just young ophthalmologists, but senior ophthalmologists also can learn a lot from your model. And I just want to add that when we go international beyond the borders and meet people, networking is not just simply handing over your business card or your contact details. It is about genuinely building a connection and trust-based relationships. And apart from ophthalmology, you should also have non-ophthalmology related goals like hobbies, other values, other missions in life, and everything. And you know that you are going to meet people from different cultures. So most important thing I think is respecting the diversity and adapting communication, respecting religion backgrounds and so on. So I think it's wonderful talk. Thank you. Thank you for having me.
Thank you, Azam sir. Another person who I really looked up to is our ARC chairman, sir, for this kind of networking and related topics. A few words, sir, on networking and fostering relationships. You're on mute, sir.
Thanks for telling I'm muted, Prasanna. I wish to be unmuted always.
Thank you, sir.
It's Vanakkam, Namaskar, and good evening once again for all the friends from abroad also. And Prasanna, I would always say that you are brilliant. That's the word I used always whenever I see you, brilliant. And you shower your brilliance to others. That's what is important. And me sitting over here as a chairman, it doesn't mean that I have much feathers on my cap. But today I had 3 to 4 more feathers learning from your achievements. And I'm so happy, as Madam President rightly said, that you're humble. And like Dr. Azam Mohammed, a good friend of ours, also said that you don't hide yourself. You open up yourself, and you teach us for free. We don't have to pay some dollars to learn from you. So these are all certain good things what we learn, and I'm expecting a lot from you in a couple of more years working together with you. And nice to see our good friends from all over the country. Anujit, nice, nice. Samir, another young chap, and my dear brother Madana over there, and all lovely friends. And this evening I am really inspired. And at the same time, I won't call nowadays. From now onwards, I won't call you guys Yosi. I would call you guys Mayosi, because you are master Yosis. I would say that. Thanks a lot for the opportunity, Prasanna. Over to you back.
Thank you, sir. Thank you, sir. Thank you, our beloved ARC chairman, sir, Ravi, sir. I've learned a lot from you personally in a very active way and a passive way when we shared Pegasus together, and looking forward to more such interactions with you, sir. Thank you. With that, another episode from today, another dynamic young leader, Dr. Vinod Arunachalam. Over to Dr. Sameer to introduce the speaker of the day, Vinod, sir.
Another very dear friend, a mentor and senior is Dr. Vinod, who's currently working in Chennai in a very dynamic, Trichy, and a very dynamic young ophthalmologist. I've got the chance to interact with Vinod sir at several instances, and we have discussed a lot of things on that. So sir is currently based in Trichy right now, where he is running his own practice, Vinod Eye Care Hospital, completed his MBBS from Chennai. And then he did his fellowship from Arvind Eye Hospital, has completed over more than 7,000 cataract surgeries. Then we have our international panelist, Dr. Lala, who's working in Azerbaijan. She has several accolades to her name, over 2,000 VIA surgeries, 4,000 cataract surgeries. She has performed a huge number of intravitreal injections and refractive surgeries as well. So she's more of a pan-ophthalmologist, and she currently is occupied with several professional roles and several awards and recognition to her name as well. A very warm welcome to you. And a very dear senior, again, Dr. Anujit, who's currently working in BBI Foundation, Kolkata, and has received several awards for his work. Very hardworking, and more importantly, a very good mentor. So over to you, Dr. Vinod, sir.
Yeah. Is my screen visible?
Yes, sir.
So I thank you, UC and TNOA for this opportunity. So the topic for the day is social media, the conference multiplier, and the personal branding tool. So the conference hall versus trending hashtag. So let me start with a simple thought where a conference inside the hall reaches a few hundred people, but the same conference, when it's amplified to social media, it may reach thousands, sometimes even millions across the world. So that's the real power of a digital sharing. It multiplies our impact far beyond the physical walls of the venue. So it reaches more people. So why do we need to use social media conferences? Because it extends the audience beyond venue, and people who couldn't attend the conference still learn from the highlights, whichever you post you do. Second, it creates engagements. We can create the engagement through the live tweets, your reels, or even quick polls, so that people can participate instantly. And it also acts as a digital archive, so you can post your highlights or the reels in the story or the reels in the highlights, so that people who missed may when they come and see your profile later, they may see through this, and they can also go to the concerned YouTube page or a link where you posted your talk, so that you can get a more reach, even though the people who didn't attend the conference may have the chance of seeing your reel and get the idea of the talk which you spoke in the conference. Coming to the other point, where it's also point of a personal branding through the conference. So how it helps us personally. When you post about your talk, your poster, or even a workshop, it showcases your work to a wider network, where it shares quick learnings, and also you can, in the picture you can see Dr. Ashraful is a good friend of mine, where I met him in Coimbatore during his training of a short-term glaucoma fellowship. When again I met him in the APO conference. So when you collaborate with the people, tag the APO tagline as well as Dr. Ashraful, your reach will be beyond. So the beyond boundaries, your reach will be there. So many new people come to know about you, as well as the visibility is more when you tag the societies and the concerned persons. So the consistency makes you the go-to person in your niche. Your online identity today is your visiting card tomorrow. So how to use the conferences with the social media? Practical tips. Before the conference, announce your talk. Make a nice flyer regarding your topic and attract the people towards the session of which you're going to talk. And share the key quotes, pictures, reels while the talks is going on during the conference. And afterwards, put the key points and takeaway summary, and always use the hashtags so that people will be able to put the hashtag, for example, lens-induced glaucoma or any open glaucoma or acute attacks, some hashtags. It might pop out in the social media whenever or how many months or years later when they see. And the caution regarding the social media, always maintain the professionalism, your privacy, accuracy, and permission of the patients, whereas the conference ends in the hall, whereas social media make them live forever. And don't just attend the conference, multiply its impact, build your brand. And so that's it. So you can see the picture of our Your network from one of our meeting. So through this, the networking and you're sharing the knowledge as well as the across the borders, as Dr. Prasanna said, globally we can connect with the young people. And our social media is one of the leading or the most powerful tool which we need to use. And I hope I have thrown some light in this 4 minutes talk on social media and conference participation. Thank you.
Thank you for the great speech.
Thank you.
Yes, yeah, I'm Lala Mamadova from Azerbaijan. About your speech, I would like to add, as you mentioned also, to use the social media at the conferences, it's always so useful. For instance, in European Society of Ophthalmology, as I'm the social media subcommittee chair at the SOE, we're always doing the Instagram takeovers. We're doing like opportunity to show the young ophthalmologists doing takeovers of our social media platform to show the conference, to show themselves, and to show that event to the world globally. And it is so helpful because in my case also I started with the Instagram takeovers, and it growth me like improved me like a professional. I'm doing it from year to year the more professionally, and it made me like well known, and it inspired me. And in my case, I know that when I started my first Instagram takeover, it was in Azerbaijan. I started to show our YO committee conference all over the world. And from the other side, the social media is also useful to show your society, what you're doing. And as Prasanna also talked about the global networking, I think global networking is not only to give your card, personal card to keep the network. To keep the network is the second part is coming to social media. Yeah, I don't want to keep so long, but because social media is a great platform to speak, we can speak more and more. And thank you again for your speech. Yeah, thank you.
Thank you, Devi.
Thank you, Vinod sir, for that amazing speech. I'll just take one line from Lala ma'am's small take. Her Instagram takeovers have really introduced the entire YO circuit of India to her. Ma'am, you are very famous just because of these Instagram takeovers. Just to add to what you said, it does make a huge impact as on social media. And Vinod sir, you mentioned something about online identity being your visiting card. I think I just want to take one small point from there and just add to this by saying that our social media is our portfolio. It's not always what we post today and tomorrow is what that people will see, but it's mostly things in retrospect. So once we make a new connection, for those who are thinking about posting or projecting themselves on social media, it's not what you post today. Don't expect a result from it tomorrow morning or a couple of likes or a couple of shares. It will not happen. But please believe me that if you keep on posting, there will come a time when someone will go through your entire profile, like sir said, like his CV, and actually understand everything about you. Not only that, where you would be a good candidate to include in certain functions, and not only that, where they can collaborate you if they are your juniors, or they can pick you up if they are your seniors. So the only advice that I have is, as a portfolio, it works like a charm. With that, I think we can take it back to the moderators.
Thank you, Vinod sir. Vinod sir has always been a path breaker when it comes to social media, and he has really taught a lot of young ophthalmologists on how to go about social media. And I try to take a leaf of feather from his hat, and I'm trying to follow it in a very different way. But he's more organized, and he's also currently taking care of the TNOA handle as well. And we would also like all of the international faculty who are here with us to follow our channel, and request her to post the QR code once again in the chat box.
Yeah. Thank you, Prasanna. I'll do that. Thank you.
I just want to say a few words about Vinod. I'm amazed at the speed that he posts on the media, social media, and the amount of reach that we get out of it is amazing. Really thankful, because I think the entire year I'm looking forward to support, and from Prasanna as well, and all of you. And without this social media awareness, that whatever we do in the as a common person in TNOA will not be known. So, as a person who is much older than you, I've realized it too late in life. But anyway, it's better late than never.
Thank you, ma'am. Thank you so much for the kind words, ma'am.
Yes, with that, I would like to call upon another dynamic, a young leader from TNOA in the Leaders Forum, also part of YOSI, a senior sister, I should say, Dr. Shruti Nishant ma'am, who is the head strabismology, pediatric ophthalmology, and neuro-ophthalmology at MNI Hospital. And she has n number of awards and accolades. She's an innovator. Multiple travel award recipients. She has won the best paper posters in the state, national, and she is very active in the international forums as well. And ma'am has also presented posters in the RO multiple times in 2022, 2024. And welcome you, ma'am. With that, I would like to hand over to Dr. Nishan, sir, to introduce the panelists. Dr. Nishan, sir.
Yes, Prasanna. Hi. So it gives me a privilege to introduce Dr. So she's an ophthalmologist and a cornea specialist from Mongolia. So thank you so much for accepting our invitation and joining with us. So she did her MD in the Mongolia National University and MSc in medicine, with her thesis being infectious keratitis. She's also finished her cornea fellowship from LBPI Seoul National Institute, and she was part of the leadership development. That is where Prasanna would have met in the LDP. And she is a recipient of so many awards, and she's been experienced with an amazing hands-on with her corneal and cataract surgeries. And she's also had peer review journals of 10 plus. And next in the panelists, we have Dr. Amog. He's a good friend of mine. So he finished his master's in RIO and also finished his fellowship in Joshi Eye Institute, Hubli. And he's got a very good hands, and he also presents very well. His presence is known in all the conferences because all his talks will be really amazing. One of a bright student who's got that best paper, best physical poster, and I think he's also won a lot of quizzes as well. So we welcome you, Dr. Amog. So let's have an interesting talk by Dr. Shruti.
Yes, thank you. Thank you for this wonderful opportunity, and thank you, Prasanna, for all calling me a sister. I think that's really nice of you, and it's always been like that between us. So I'm really glad. So I'm just going to share my presentation. So today I'm going to be talking about a very important aspect of conferences, and that is the industry, and which most of us young ophthalmologists kind of tend to shimmy around the periphery of these stalls and run away because we feel that all our thing is in knowledge gaining. But here I am to kind of convince you all that industry is a very important part of our young ophthalmology journey. And we will, as we see as growth happens, that how important the collaboration matters. So before we prepare for the conference, as we prepare for our posters and papers, it's also important to prepare for the brands and the companies that we are going to be visiting. And more often than not, your representatives will meet you in your clinic and tell you that, ma'am, will you be coming for this, sir, will you be coming for that, and are you prepared? And just give you a gist of what their stall number is and so on. And that initial interaction actually sets the pace. And always when you talk to them or meet them, ask them for any offers or anything that's new that's happening in their stalls, and that would give you an idea to go and meet their stall during the conference. Sometimes when you have a good relationship, they would call you for invited talks. They always have these stall talks and these kind of small niche group meetings that happen. And if you're kind of in a good books, then probably they would have some invited talks over. And of course, there are these really company-sponsored invited dinners, quite exclusive, and then you kind of get to go visit them. They're a great networking opportunity where you get to meet real big leaders in the facility, in the conferences on a very intimate level. So again, prepare for your conference, not just for the posters and the presentations, but also for the industry visits that you're going to be making. And once at the conference, I always make time to visit all the stalls in the conference. And it's not just the curiosity of it. There is so much more that we can do. The number one is the new products. Invariably, all the latest machines and the gadgets are going to be on display. So you get to see the latest of the latest, the cutting edge of technology. And as a UO, I am always interested in what's new and what's at the cutting edge so that you get to see new products. The second thing is you experience equipment firsthand, and you get to see, you also get to compare the same equipments from different brands. You get to meet the heads of the organizations, of the companies and the brands, and then you kind of interact with them, and that gives you a different level of networking. And also when you have a good interaction with them, they kind of market indirectly for you. They go tell other ophthalmologists and other brands about you. And then this kind of networking along the industry level also happens on a good level. And also when they have new products, you can talk to them for collaborations, for research and so on with the company. So these are all the reasons why you would visit the stalls. You look for good opportunities, like you look for international collaborations, like when they have their different heads coming, the regional and the international heads, they kind of allow you to interact with them. There are good research opportunities like new products. You try and test them out in your clinic. And there are good opportunities to travel abroad. If you feel that you have really good stuff, then they kind of use your expertise to take it forward. And you also try to bring in new colleagues, your friends, to kind of introduce them to the heads and to the organization, to the industry and to the brand, so that they kind of feel nice about it, that this doctor is really invested in trying to bring people on board. And the ultimate end goal is to become a KOL, and that's a key opinion leader in whatever product that you're trying to go. And this is something interesting that we had, where we tried out the 3D microscope, and after the conference, the demo was bought and kept in our hospital, and with our feedback, the 3D microscope was actually improved, and that is actually what we aim for, and that's the whole point of the conference's success. Then again, these are some of the pictures that we had. These are some as sponsored conferences that we've had. These are some of the conferences where we have attended and we actually collaborated. This is the Professor Bigpo, who's from Russia, and we closely collaborated on him on several projects because of industry. Here again in Russia 2024, this was an industry-sponsored talk where we get to see and meet new people. And not just that, I got to learn about orthokeratology through a very in-depth one-day session with them on a personal level. And I was able to start up my orthokeratology practice here after that. This was again in China, again an industry-sponsored visit, where we got to go and look and learn myopia on a big level. And this is the highlight. And these are 2 RVO conferences that was again actually pushed by the industry, because I had really good papers and I was not making use. They pushed me to present this. And again, it gave me a really good opportunity to meet the head of the big group called the Rotterdam group. And they present, this was Professor Klaver, who I got to meet because of the industry. So you really get good opportunities if you're interested in research as well. And then moving on to the next important part, which is innovation and industry. I'm sorry about that, which is about innovation and industry. In innovation and industry, I think more often than not, when we have an idea, it's important to know whether this idea is something that can be mass produced, where we look at the market opportunity, or a niche product where we look at the market need. Now, once we have this innovation, we immediately say, wow, I have this idea. Now I'm going to be this great big entrepreneur. But more often than not, the process is not just a single arrow, as I'm going to explain to you. Whenever you have an idea, you need to vet the idea. You need to make sure that the idea has not been done elsewhere. Then you kind of develop a prototype of that, and then you apply for your patent. But having said that, the most important is market evaluation, which most of us do, like we present in conferences, in award sessions, we discuss with our clinical colleagues and all of that. But once we do all of that, what next? And that's where the industry partnership comes in. We need their expertise, their market access, their resources, and their regulatory processes. And all of this is something we are not good at, which the industry can really bring forward. But this is what this space, this is there. It's called the valley of death, because most of the ideas die right here, because as ophthalmologists, we have a hesitancy in sharing ideas. We do not know how to collaborate. And whenever these things comes, we usually use a non-disclosure agreement to kind of build and bridges across the 2 areas. And more importantly, there are 3 ways in which you can partner. One, if it is a niche product, something which is non-ophthalmic, then you need to develop the prototype by yourself and then go in for grants and startup investors. Whereas when it is an ophthalmic device or something where an ophthalmic partnership can be developed, you co-develop it, or you can use a co-investment. When you co-develop it, you can reach out to universities, the pharma industry, the IOL industry, the equipment industry, and you kind of demand a royalty of it. And if they're going to invest in yours, then you can actually form a company where you can have talking about scaling, marketing, and distributorship. So industries can also help very critically in this. These are 2 products that we have developed. One is the sundial, which we had collaborated with a non-ophthalmic industry. And this was an ophthalmic pharmacological biodelivery system, which I had invented and patented, and both were patented by me. And again, this one is now in talks with pharma companies, where we're trying to kind of innovate and bring it into a mainstream product as a mydriatic spray. So having said that, it's very important that the best collaborations create something bigger than the sum of what each person can do. So the 100% industry has a very important role to play in this. Thank you so much for the opportunity.
Fantastic talk, Shruti. You put it all in a nutshell, and doing it in 4 minutes was really good. And it's definitely a lesson we all have to learn. And like you said, most of the ideas die a slow death within ourselves. You're scared of telling your peers and exposing it. And so this will definitely be an inspiration for many.
Thank you so much, Shruti ma'am, for the comprehensive covering of both the topics, in fact. And It's one thing that I wanted to share here is that every innovation session I always see Shruti ma'am either as a participant or even as an audience in the few conferences I attend. So she's the right person to have shared about this innovation to us. And I request our international panelist, Dr. Undarma, to share her perspectives on this.
Hello, everyone. It's a pleasure to hear, and I would like to thank you organizing for this great webinar and the presentation. I'm Underma from Mongolia. Usually nowadays across the globe, we are witnessing the rapid introduction of the many new technologies and the advanced equipment and the machines in the ophthalmology. These innovations also, we are transforming the way we diagnose and treat and care to our patients and making eye care more effective and accessible. Before I studied abroad, I didn't about the OCT. It's 5 years ago, and I studied at the South Korea, and that time I see the OCT machine in the South Korea. That's the more different technologies and the more equally accurate diagnosed patients in my life. The midlife is, for example, is the 1990. We have not the OCT machine. Nowadays, we have a different kind of the OCT machines, especially in the high new technology of the spectral domain OCT. Also, we can use the confocal microscope. That's the new technology, and also we treat the more effective of the patients.
Thank you, Dr. Undarma, for your perspective. Over to my good friend, Dr. Amogh. So recently, Amogh has won best paper sessions for a very interesting topic of one of his innovations, Vardhan. So congrats to you, Amogh. He recently won the ACRS as well as the best paper of the session. We're very happy to have you with us, Dr. Amogh. Over to you.
Thank you for the kind introduction and very well summed up, ma'am. I mean, whatever you spoke, I don't think it could have been summed up better, the topic per se. And I think for a young ophthalmologist, attending conferences and going to stalls is very important because we generally are bound by our budget. We have budget constraints. And when you actually meet the head of brands, they are willing to invest in you and give you machines for cheaper. It's always a good way to meet the head of brands, the head of companies, getting to know them better. And as Niranjan said, for my invention, I was actually running helter and skelter of thinking how to put it into production, learning the finances of it. But then I met a kind person, basically a surgical guy who offered to make the device for me and then market it and sell it for me. So I think it's a great way to interact with people who are not from our field, gain perspective. And as ma'am said, that there is a valley of death wherein all our ideas are generally put to death there. I mean, they died there. So actually having gotten to show my invention to people and people encouraged it, and that's the reason I got to present it at so many places. And I think it's a great place. Conferences are great. I mean, it's a great place to meet people from different specialties and people who are not from our profession, gain perspective and maybe put it into practice. So I agree with whatever ma'am said, and thank you.
Thank you, Amogh. Thank you, Undama, and thank you, Shruti ma'am. With that, we are moving to the last segment of the day, and I would like to call upon, just like how Nishan sir was one of our torch bearers for VAYO, Dr. Madana Gopalan sir, along with Dr. Nishant, showed us the way in the VAYO platform, and we are very grateful to both of them. Over to Dr. Madan sir to invite the next 3 sets of the last lot of the day.
Thanks, Prasanna. It's indeed an honor to introduce Pranesh, a good friend of mine from our days at Netralaya. So he's a cornea and a phaco-refractive consultant, worked with many tertiary eye care institutes. And what I like about Pranesh is he's one of the very few clinical ophthalmologists who's proficient in machine languages like Python, JavaScript, and HTML. The way he speaks, it's in a different tangent altogether. So I always look forward to hearing him speak about ophthalmology and other domains. And along with him, I'd like to introduce the panelists, Dr. Kaushal Pokhrel. He's from Nepal. He's the refractive surgeon at Tilganga Institute of Ophthalmology. and more importantly, he is the founding president of the in Nepal. He currently serves as the treasurer of the parent association, that is the Nepal Ophthalmic Association. And again, another good friend of mine, Dr. Shobana, who's from here. She's completed her post-graduation from RIOGOH, and she works quite close here in Namakkal. A very dynamic surgeon and very talented person as well. So look forward to this particular session to give a good conclusion to this meeting. Thank you.
Thank you, Mahan. Due to some logistic issues, Pranesh sir is not able to join us today. So he sent us his presentation as a video, and I'll be sharing it with you all right now. Is my screen visible, sir?
Yeah, visible.
Yes, Narendra.
Good evening, everyone. My name is Dr. Pranesh Ravi. Today I'll be presenting the topic pre-conference planning, setting your learning goals, navigating the scientific program. In the outset, I'd like to thank the President and the Chairman ASC of TNOA, the moderators and conveners of the session, and the international faculty from Southeast Asia present. And I'd like to thank TNOA for giving me this opportunity. To start with, for the conference planning, I'd like to take the TNOA 2025, which happened in Puducherry as an example to say how to plan for a conference. Here in Cherrycon 2025, there were 133 hours of scientific content across 3 days in multiple halls, and we had first time inculcated the silent conference format. So the key highlights were breakfast with experts, Ophthalmic Premier League, and Shark Tank for Innovation. So to start with a conference like this, it's always better to download the mobile application. So you would have the whole program book in your hands, and then you can plan for the conference accordingly. So that's what you should first do. Second thing, you can plan early for maximum impact, preferably like 2 days before. You read the program book, research about the speakers, identify who you want to meet, and if you want to take part in hands-on courses, you can register for the hands-on courses. As the seats are limited, and if you're presenting, you can submit your abstract for presentations well in hand. If they get selected, work on that 2 weeks before, and you can do dry runs so that you do your presentations better. And 1 week before the conference, you can create a session priority list. So the most important ones is primary, then work your way towards secondary and backup so that you make the maximum out of the conference. And also, conference is not always about getting academic knowledge. It's also about networking to know the leaders and the standards in the respective fields so that you work on that to identify the key people to connect with. And then always arrive at a clear plan and not just hope for the best. And this 14 days time would be more than valuable to do that. So next thing is you want to plan on the instruction courses, which one to attend. So the best instruction courses which you can come across, you can just line them up. The ones which I found really interesting were the Safe Echo and Dropout Cataracts by Sujata ma'am, and then you can this complications of echomislocation by Arup sir, and this is also very interesting, I see, and also another program which was spearheaded by DC sir. So this is also something you can think about. So these are things you can plan before, so that you can work on your planning your conference much better. And finally, the glaucoma debate, which is very interesting, like which one to do, which one to do first, as Prasanna was a part of. All these things you can definitely think of. You can note them down, the days when they are going to happen, so that you can make the best out of it. And next, you need to, if you have something new like a silent conference, actually it's much better because you can listen to a lot of talks sitting in the same room with your receiver. So you should plan how to use the tech and get really accustomed to it so that you can make the best out of number of hours you're sitting in that area. So this is actually very good for the thing and without moving around a lot. Next, for session selection, you should can plan using the 70-20 and 10 rule. So 70% of core subspecialty, whatever your primary specialties, be it cornea, be it retina, be it ophthalmoplasty, and 20% is adjacent field. This complementary will help you because you're always not going to practice your specialty always. You're primarily going to be a comprehensive ophthalmologist. So it's always better to slightly focus on adjacent fields too, and then 10% on innovations and trends, so that you can explore them and also consider expanding your future opportunities. And priority can be it should be mostly towards international faculty because they will bring something new to the plate, and instruction courses, debates, and case discussions, so you can get real life perspectives and expert perspectives too. Universal sessions, court martial, OPL, and AI and ophthalmology sessions are really good. Court martial, it's got high entertainment and you can learn a lot. OPL is it's a unique thing for TNOA, and all these things you can definitely think about. So in the subspecialty, you can when you're focusing on subspecialty, general ophthalmologists can focus on comprehensive ophthalmology sessions, cataract complications, and their management. Subspecialties can focus on latest surgical techniques or latest treatment advances in the respective specialty, challenging cases, and you can also focus on the research paper presentation on the respective field. And it's always better to focus on quality over quantity. Interactive sessions, one thing is stalwarts usually there's a session breakfast with experts where you can go stay with them, meet them up close, and you can ask them your queries so you can create an impact. Because the seating is limited, you have to recognize early. Jam is something just a minute where you can get a short gist of what the presenter is presenting, so you can learn a lot in a minute. Debates, you can get dual perspectives. So whichever subjects you find that you would want multiple perspectives, you can definitely attend the debates. And MTO bucket session is something where you can ask or whatever queries you have without any inhibitions, and you can clearly get an idea whether your knowledge gaining has been correct, or you can have a
Prasanna, the video is not working. Niranjan?
Niranjan is sharing it.
Niranjan, are you there?
Not being in the session, and you can ask where you,
Yes, ma'am.
what were shortcomings were, and you can ask about they'll help you, and you can not make this mistakes in your future presentations. And poster presentations, you can interact with the judge and you can explain them.
Yeah, ma'am, I think we'll move to the panel discussion, ma'am, keeping time as thing. Yeah, we'll move to the panel discussion. Dr. Kaushal, over to you, Dr. Kaushal and Dr. Shobana, for your valuable comments. Kaushal? Yeah.
Good evening. Thank you so much, Prasanna, for the opportunity. I really love coming to your events, and this is always the best. So yes, so I remember it's funny, but I kind of think I'm a bipolar disorder person when it comes to conferences, because I remember myself like few conferences I've been totally into lectures and stuff, not attending anything else, and it was really exhaustive. And on the other flip side, when I come to India or places where my friends are, I remember not going to any conferences, hanging out with my friends and enjoying. I think unless the webinar is going to make me prepared for the next conference, I guess. About when you talk about attending the big YO conference that's coming in about a week time, I think there's a huge exhaustive list of events that's going to happen, and this conference, trust me, is going to help me tackle with that stress. So yeah, thank you so much for organizing this before the conference, and best wishes for the YO conference coming in a few days. Thank you.
Thank you, Dr. Kaushal. I had the privilege of sharing the podium as a panelist with Dr. Kaushal, and he's one of the most dynamic heroes I have met. At APO, I had the privilege of meeting him, and we are very happy to have you with us, Dr. Kaushal. Thank you so much.
My pleasure, always.
Dr. Shobana, over to you. Just unmute yourself so that, yeah.
Am I audible?
Yes, please.
Yes, thank you to the entire USI team for giving me this opportunity. So, in preparing for conferences, I usually start on 1 week prior, where to go, what to plan, what all sessions is really useful for me. So I start from like looking at the sessions which I need, even from my first year residency. So I started to attend conferences. So my first year was full of learning what are the newer topics, the newer terms, the newer ideas where my first go in the first year. Then in the second and third year, I used to attend the wet labs. I used to do the iris hooks or the SFT. So the small things I started to learn from the wet labs, and each and every how the people scenario, making friends, networking with the ophthalmologist, and their career growth, and that every point would be inspiring for me at each and one point of time in my life. So I think every person, young ophthalmologist, need to work on how to attend the conference 1 week prior, and start planning what to attend, how to attend, and prioritize the list, and make a note of it, and go through each and every topics, and I make notes of it, so that will be useful when I do a theory or some practice or some kind of OP management, where I get to recollect those things and apply those things. So I think planning conference is really important.
Thank
Thank you. Thank you.
you, Dr. Shobna. She is one delegate in every conference who walks around with the program agenda with pen markings on it. So she does it the classic old style. And thank you for your insights. Over to Prasanna, sir.
Thank you. So we just shot 6 minutes into time. I think with that we'll have the novel e-certificate distribution introduced by our president, Dr. Sujata ma'am. Since it's a cross webinar, ma'am, we really wanted to acknowledge you as well.
Thank you.
Thank you for the wonderful opportunity for being with VIOS, for this wonderful initiative, making every conference count, along with our beloved ARC chairman, sir, for taking time for VIOS. Thank you, sir. And means a lot having both of you at the helm, with our torch bearers, Dr. Divakant Mishra and Nishan, sir. Again, it was very unfortunate he has turned 40, but we really had a great time with Nishan sir. Showed us lot of way forward. I think
There is always still the yo leader for us, sir.
yeah.
Hey,
So,
once a yo, always a yo.
Always a yo.
யாராச்சும் ஏஜ் கேட்டாங்களா?
Yes, sir. And Madana Gopalan, sir, as well. The two torch bearers for us in the national podium. Nilesh Kumar, Secretary of UC, and the conveners of day.
Thank you.
Karthikeyan, Dr. Samir, Dr. Madhavi, and of course, Dr. Nilesh. And with that, I am handing over to Niranjan for the speakers. Over to you, Niranjan.
Thank you, sir. So thank you each and every one of the speaker and panelists for having joined us and shared your expertise. So starting with Pranay, sir, who spoke about preparing for conferences, and Dr. Kaushal and Dr. Shobna, who gave their expert insights on that topic. Next, we like to thank Prasanna, sir, who's given the entire comprehensive networking guide, book 101. So thank you, sir. And we had Dr. Azam and Dr. Deepak sharing their insights on this topic. Next, we have myself.
Yeah, I'll thank Niranjan for his 2 cents on how to go about making his conference count. How he spoke a lot on mentorship, how mentorship played a role, and well supported by again a good friend, Dr. Vidya. So Dr. Vidya, actually, again, when I launched my org, she helped me get it in Malaysia. So I think this is what networking is all about. I never expected that I'll be writing a book. If not getting it in 28 countries was only a dream. I think that's what the power of networking is, and she really made a lot of difference on the social media as well. And thank you, Dr. Vidya, for being here again, despite the time zones. To all of our friends, you guys all took a lot of time to be here. Just keeping a bit.
Shiva, sir, for sharing your insights as well on the novel mentorship programs available on various platforms. Thank you so much. Then we have our media master, Vinod, sir, who is a very dynamic person, both online and offline, and Dr. Lala from Azerbaijan. And we had wonderful insights from her perspectives, and our another social media star, Dr. Anujit, from Kolkata, who is a very dynamic person in several platforms. Next, we have our refractive pro, Dr. Aditya Varman, who shared his insights on traveling beyond borders to learn skills through wet labs, and well supported by Dr. Mohammad Iftikhar Iqbal from Bangladesh, and also by Dr. Mohammad Abrar, who shared their insights on this topic. Finally, we had Dr. Shruti Nishant ma'am, who is an innovator by every conference. She is there as an innovator and well supported on that topic by Dr. Amog and Dr. Undarma from Mongolia. And thank you each and everyone for making this webinar a grand event. And over to you, Prasanna sir, for concluding remarks.
Yeah, thank you, Niranjan, for helping out with all the logistics of this whole event. Credits to you for getting the skeleton of the whole show ready. Thank you for that. With that, I'm handing it back to our ARC chairman, sir, and President ma'am to conclude the whole event of today. Over to you, Ravi Shankar sir and Sujata ma'am.
Dr. Ravi, you want to say a few words?
I've said enough. I can't be showering more on these guys. It was really wonderful to be part of over here with you all. And hats off to the OC team. Prasanna, you did a wonderful job. Thanks being part to TNOA ARC. Over to Madam President, please.
Prasanna, I wish I was 30 years younger and part of the UO team, because I have so much to learn from you, and what I've lost opportunities. That is what I'm thinking. So I think you definitely need a big round of applause, all of you. Fantastic round of applause. And I hope that we have more and more, inspirational talks like this, so that we can get everybody into the groove. Once again, hats off to Prasanna and Niranjan for pulling out such a wonderful program. It was so interesting. Every minute was interesting. The discussions were very good, and very happy to be part of it. I think we should do more in the future.
Thank you, madam. Thank you so much. Prasanna sir, will be...
Thank you. Thanks to our designers, flyer designers as well, Mr. Bala and Numerotech team for helping us with the background. With that, Manjula ma'am, can we go off live?
One second, doctor.
We'll end this with a photograph, ma'am. Yeah, ma'am and sir.